Thank you guys for tuning in to another episode of the Infertility and Me podcast. I am your host, Monique, and I appreciate you for tuning in and for returning if you're a returning listener. I thank you again for your support these last 6 to 7 weeks. Today is January the 7th, and I have with me Miss Kendall. She is a licensed professional counselor and she is a mental health counselor and holds a professional membership with Resolve, the National Infertility Association, and the American Society of Reproductive Medicine. Kendall specializes in supporting individuals who experience challenges with fertility using a compassionate approach. She provides comfort and openness for people to share various thoughts and emotions that occur during their own reproductive journeys. Kendall's passion to advocate for others during their fertility journey stems from her own experience as someone who has struggled with fertility challenges since early adolescence. Both personally and professionally, Kendall has gained understanding on the need for emotional safe spaces for people to connect and seek comfort when trying to understand and process all that can occur when faced with limitations around the ability to conceive. And Kendall is going to share with us today her journey and a little bit more about what she does as a counselor. I will have all of her information in the show notes, her Instagram, as well as her website. As always, the infertility and me information will also be in the show notes for the website as well as the Instagram account that I have for you guys to connect with me and to get to know me a little bit better and for your daily dose of inspiration and what I like to call infertile thoughts. Also on my website, I have a blog set up with show notes for each episode as well as a category called infertile thoughts, which is sometimes I do impromptu blog posts, and sometimes I will post ideas and thoughts surrounding infertility from my Instagram account. So you guys can check out the website and look at that information as well as read the about section and get to know me a little bit better if you're new to the podcast. And again, I thank you guys for tuning in. We are now 1,000 plus downloads in 6 weeks. And today is what, January 7th? Yes. So it's been about 6.5 weeks since I launched the podcast. So I appreciate you guys for sharing, giving your feedback. And I ask that you would just subscribe and also connect with me on Instagram. And so that we can get to know each other a little bit better. If you'd like to come on as a guest and share your journey, and connect and heal with me on the podcast, I'll be more than happy to have you. So reach out to me through the website, through email, and also on Instagram. You can connect with me there, and we're going to get right into the episode. Thank you guys.
Yes. So, hi, my name is Kendall Bassard. I'm a licensed mental health counselor who practices in the state of New York. I have been practicing for about 5 years, but actually have had my license as a mental health counselor for since February, so almost a year. I was practicing under a permit. I specialize in trauma, particularly with grief and loss, PTSD, infertility. I graduated from North Carolina A&T with my bachelor's in psychology, and then I actually went to Columbia University, where I got a master's of arts and a master's of education and psychological counseling. I then really actually migrated to working with women in prison system upstate in New York. So I worked at a minimum and a maximum security prison, helping women with women's health, advocating for them to get their needs met through the medical staff, and then also just educating them about their health and their reproductive rights, just really understanding how they can have still quality care while being incarcerated. I then worked in a domestic violence shelter for 3 years, where I worked with children from infants to 5 and dealing with mothers who were dealing with trauma around, having children after being exposed to violence or abuse, kind of helping them understand the impact of trauma in the womb and post that. And then also working with the children through play therapy. And then also working with adolescents who experience some type of trauma. So then worked with women and men who experience domestic violence. And then I started working in a private practice under my permit and working specifically with adults, helping them through life stages of adjustments, anxiety, depression, again, post-traumatic stress disorder, women who were facing infertility. And then that also then led me to where I am currently at a private practice again, where I specialize in infertility and women's health. And then that led me to then being a member with Resolve and really focusing and trying to help women and men or anyone who is dealing with any type of reproductive challenges, and then coming to an understanding and having a safe space to connect to their own individual journey.
Wow, wow. Well, congratulations on all of your accomplishments, work, and your education. That's amazing, and it's wonderful to hear that you are, so well well, not really rehearsed, but so well educated in your specialty, and so people can feel confident in your ability to help them and go beyond just being a coach or a mentor. So that's great. And I just wanted to ask as well, Kendall, so that everybody can get to know you a little bit better. What has been your experiences personally with fertility or infertility?
Yes. And so it's interesting where I feel God and life lead you. So I knew since 15 that I wanted to be a therapist. There was no doubt in my mind that therapy was my niche, whether it was just family dynamics or the environment in which I grew up with and having friends that would go through things, or my own personal losses that I experienced from a very early age. I knew also, like, I came from a house of educators. My dad is from the South, and my mom is a Washingtonian born and raised in DC. And so my dad's family, a lot of people are nurses and teachers. And so I first thought I was going to be an early childhood educator, and I really have always had this maternal energy and loved children. And it wasn't until I took a class and I took an early childhood class in high school that I realized I wanted to, what I thought, be a child psychologist. So again, I've always had this strong connection to children, and I was the first girl in 15 years, or I think 15 or 17 years on my dad's side of the family. So I had a lot of older cousins who, by the time I was starting to develop into my adolescence, had kids. And so I would see my cousins at the age of like 24 getting married and having children, and it always resonated to me. So I always knew I wanted to be a mom, I wanted to have children, and then I wanted to potentially work with children. So when I actually was in college at the age of 19, I had my first ovarian cyst. And it was such a powerful experience because at that time I had no clue what a cyst was. And I think when I think about just like how we as women are educated about our reproductive like organs, it's more about like sex. And I feel it's more about like us being able to have children, the things that can prevent us from having children to a degree as far as like STDs or HIV, but they don't really tell us about the things and the really educate, or for me personally, I don't feel I was educated enough to know the functionality of my reproductive organs. And so when I was 19 years old, I remember actually being in my dorm and getting very sick. And I remember throwing up and having like kind of more of a difficulty when it came to using a bowel movement. And I say these things not to be crass or to get too personal, but I say these things to educate women on certain signs of what happens to your body when there could be something that is wrong. And so I remember actually calling my mom and telling her like something doesn't feel right. And so she was like, well, maybe you have a UTI. And again, I wasn't familiar with that terminology. And she explained to me that that was probably like a urinary tract infection. And so then eventually I was like, okay, well, let me see, like maybe I should go, go to get some over the counter stuff to treat something. Because I think, again, I didn't have the education and the resources to really know that I should go seek help. And I think a lot of times as a woman of color, I don't really always feel comfortable going to certain places, and especially being a 19-year-old, I was like, okay, it's just something I can go to the store and like try to deal with myself. And so then there was one night where I was talking to one of my best friends, and he was actually a male. And I told him something felt really painful. And then when I placed my hand over my abdomen, I noticed that I saw or felt something. And so then we rushed to the emergency room, and I went to the emergency room. And this part was actually very, very interesting because I actually went to the emergency room. I got cultures done. They came out negative. Actually had a boyfriend at the time, and he was actually out of town when it had happened. They did a pelvic exam. And again, there was nothing that showed any concerns, but they said to me, oh, well, it looks like you may have had like an STD that you didn't treat, and now you have pelvic inflammatory disease, and you may not be able to have children. And I
Wow.
remember being so devastated by this because I didn't know what any of that meant. And even though the cultures were negative, I personally feel, because I was a woman of color, that they had just dismissed me and had told me, oh, well, you have, this, probably had an STD, and now this is what led to that. So basically making it seem like I was inadequate of caring for myself. And this is kind of what led to then the potential of infertility. So I remember the
Wow.
next day I came back to my dorm, and my brother, who was an hour away in school, who's 2 years older than me, came to visit me. I remember giving him my discharge paperwork, and I was devastated. And I was like, I can't have children. This is what they said. And I remember him saying to me, Kendall, you don't have this. And I was like, no, this is what they told me. He's like, I don't believe this. You don't have this. So we went to a movie to kind of like cheer me up. And then by the time we ended up going and leaving the movie, I was vomiting profusely. I had had
Mm.
popcorn, love popcorn, and I was just vomiting profusely. So he called my parents, and he was like, something's really, really wrong with her. And so after that, he took me back to the same hospital, and the same emergency room doctor kind of touched me, and he was like, oh, this is a lot more tender. Let's see if she has appendicitis. And so a lot of times when women have ovarian cysts that rupture, it kind of is similar to the symptoms of appendicitis, because your abdomen,
Mm.
there's usually fluid in your abdomen. There's things that can happen. You're probably usually going to projectile vomit, not always, but there's things that are indicators of something obviously in the abdominal area that's causing a distress. So then after they realized that I didn't have appendicitis, they finally did an ultrasound, which again, I say all of this to say that an ultrasound should have been done the first time. But
Right.
again, there was that assumption of me that I think prevented them from really actually tending to me in the way that they needed to and treating me in a way that would have been effective the first time. And so as I came back, they did an ultrasound, and they saw that I had a hemorrhagic cyst. And so my body specifically produces hemorrhagic cysts, which are cysts that have blood filled inside of them. And depending on how big they get or if they burst, they can rupture. And that's exactly what happened. And so my cysts would grow to be about 4 to 6 centimeters. And
Mm.
when they would grow, if they didn't have room, they would rupture. And so I started to develop this from 19 and experienced it all the way up until currently at the age of 32, going on 33.
Wow. Wow. That's a lot, Kendall. That is
Mm-hmm.
and a 4 to 6 centimeter cyst is huge inside of
Yes,
that small space of a woman's reproductive system. I know that
absolutely.
much, medically to know that there's, it's nowhere near as large in there as it looks in the pictures. That's wow. Wow,
Yeah.
wow, what a journey, what a journey. And then to be dismissed like that by the first clinic that you went to see, and they diagnosed you with pelvic inflammatory disease, right? Or that's
Yes.
what they assumed that it was because of a form of STD of some sort.
Yes.
Yeah. And I really like the statement that you made also previously about the school system not delving deep enough into reproductive health for male and female and educating us enough as
Mm-hmm.
teenagers to really know what it really is. It's a lot to cover, but it can be done, I think. And
Absolutely.
that's great that people like yourself who have educated themselves through college and such to be able to explain these things to adults, because nobody's ever been able to explain it to them, and even their own doctors
Absolutely.
are not doing it.
No.
And that, I think that's really a disservice to the education system, and as well as doctors out here treating people. And I know they're busy, they get overwhelmed, but still, they could have
Yes.
definitely done more testing and gotten you the help that you needed long before you had got rushed to the hospital. Wow.
Yes.
And so
Yes.
how are you treated now with
Yes. And
with the
so
condition?
that I feel like was the start of a very long journey, which has led me to really being passionate about reproductive health and advocacy, and also emotional safety and vulnerability. Because I think for me personally, I did not feel that a lot throughout my journey. And so after I had that experience at 19, I then was in and out of hospitals for a long time. I was blessed in a way to have a really good doctor who actually was the doctor that delivered me. And I would literally go back home, even though I was in the state of North Carolina for undergrad. I grew up in Maryland. And so after the cyst happened, I would go home to see him because he was the person that I felt safe with. And, he was really good, but he wasn't where I lived. And so he had first recommended for me to be on birth control, and I was very hesitant about it, but then decided to do it because I couldn't keep every month getting sick, and it just wasn't a functional lifestyle to live. And so
Right.
I was on birth control, and for a while it was effective and it worked. And then we were putting me on higher dosage because birth control itself can also take, depending on who you are and what your already hormones are on top of additional ones that they're giving you. It took a while to find the right fit. And so it seemed like for a while we were on a right track. And then my body was just still very powerful, and my ovaries were like, I'm still going to do what I'm going to do. And so there were times where I was still getting very sick and we were having cycles. And then there was a time where we were like, okay, let's see. So we were upping a dose, and there was a particular dose that I'm not sure if it was the dose and just the way it responded to my body, but I was actually creating, I feel like, more cyst. And then it got to the point where I had, after I graduated from graduate school, so I was 24 at the time, I had a really huge cyst that I went actually to Maryland to check out. And then there was the hurricane, I think, Irene. So when I went to the hospital, they lost my actual ultrasound because when I went to the hospital, the systems were cutting out due to the hurricane.
Gotcha.
And so I came back to New York, and then they also kept sending me home. And so eventually I kept consulting with my doctor from Maryland, and we agreed that we were going to do a surgery to remove the cyst, because at this point the cyst was pretty big, but my ovary itself was like 6 centimeters. So my ovary also was becoming concerning. And so I kept going back into a particular hospital here in New York. And there was, again, another doctor who kept telling me that they didn't think it was operable. So my parents came from Maryland. They brought me home, and my doctor canceled his vacation trip. He did a surgery on a day that he didn't even do surgeries to remove what we thought was going to be the cyst. But by the time he got in to actually do it, my ovary had already had what we call an ovarian torsion. So there were 2 blood clot cysts that were pretty big in size. And so they had already compromised my ovary. So by the time that he was able to get to the ovary, it had already lost its oxygen. So he had to remove it.
So
And so
losing
when
the
that
oxygen,
happened,
it
was
is
very,
starting to die, right?
yes,
Yeah.
exactly. And so when that happened, that was a very hard thing for me, because I went into a surgery expecting one thing and woke up to something completely different. And so there was a lot of trauma that I experienced, a lot of PTSD, a lot of anxiety. And I think it made a lot of where I am now in the spaces that I now understand that I try to hold for people in a professional space. And so although I don't go into my counseling sessions with women who have infertility and always put my experience onto them, I think that I just kind of take elements of what I think are common themes that women feel when we go through these things, especially women of color. I definitely felt sometimes silenced when I was going to the doctor, particularly, and telling her that something was wrong, and she kept sending me home. And then actually, ironically, a year later, I had a friend who got pregnant and was going to deliver her baby and had wanted me and my friends come to pray over her. And as she was getting checked, the doctor who had been working on me was coming to check her. And before she left the room, she's like, "You look familiar." And she was like, "Didn't you have a cyst?" And she asked me kind of what happened. And I told her I lost the ovary, and she couldn't even look at me after that. And she kind of walked out the room. And so it was one of those things where I feel like it came to this full circle of God telling me, I didn't lose anything. It was more of gaining something. And what I gained from that is sometimes when you go through something and you're trying to communicate it to people and they're kind of focused on what they know versus what you are actually feeling and
Mhm. Mhm.
experiencing, it can be
Mhm.
very challenging. And so a lot of elements that I think that come from dealing with infertility can be feelings of fear,
Yeah.
feelings of anxiety, feelings of isolation, feelings of frustration, sometimes being angry. Like I was angry at that particular doctor after that happened. And I was angry at myself for not feeling like maybe I could have done enough. Guilt that can happen,
Yeah.
embarrassment and shame, feelings of inadequacy that I felt for many years after only having one ovary, pressure and feeling overwhelmed about being responsible for myself, and kind of sometimes feeling a little bit maybe like anal and rigid, and having more of this fear of wanting to be in control of things because I didn't feel
Yeah.
in control. So like having a mistrust about vulnerability or of others and life. And so there were so many things that I navigated. And so in that space, I kind of look at those things to figure out how can I help other women who may or may not be feeling this. It doesn't mean our stories are similar, but it could be a space that I can hold, and so that they know that there are spaces to go to, because for a
Yeah.
long time that was
Yeah.
also hard for me to even figure out what avenues I used while dealing with the impact of all the things that my body was communicating to me.
Yeah. Yeah. I definitely resonate with that. Our stories are very, completely different. But at the end of the day, the emotions that you go through when there is a reproductive medical condition that your body is putting you through, or whether it's hormonal like myself with hypothyroid disease, and just so many other factors, ovarian reserve failure for other women, and low sperm count for men, even though our stories are so very different, we still feel connected because we have this struggle with the one thing in the one place in the one area of our bodies that we're taught that this is what it's going to be. Like you said in the beginning, you go to school, they tell you, woman, this is what you do, this is how your body creates a baby. You got to go through all the menses, you got to go through all these parts of your cycle, and then all you got to do is just eat right, do this, and your sperm will grow healthy, and all these different avenues for telling us
Exactly.
that this is what our body is. So ingrained in the school system here in the US that this is
Yeah.
what your body is supposed to do. This is what's
Hmm.
going to happen, and this is the way it's going to be. But what happens when it
Absolutely.
doesn't come out that way?
Exactly. And I definitely did not feel prepared. And I think that lack of being prepared, because like you said in life, you are trained to be prepared for so many things. And I can say I had parents that, had the resources to help me feel prepared in certain ways. I came from a middle class home. I, was able to go to school, and then I was able to further for myself personally, my education. And there was all these things that I felt like were instilled for me to be prepared for, but nothing I felt could prepare me for the thing that I probably wanted the most, which is to have a child and to be a mom. And it's not saying that I can't, but I still am a little uncertain of what that will look like based on, one, I haven't actually been in the space where I'm fully trying for that yet, but
Mm-hmm.
two, also not really knowing with the ovary, the capability that it has, being that I have a low ovarian reserve. There's so many things, again, that you're not educated on.
No.
You don't understand any of this until it happens. And I think then when it happens, you're dealing with the pain of it, the actual having to be proactive around it, going to doctor's appointments,
Mm-hmm. Mm-hmm.
having consultations with people, having to, try not to freak yourself out on Google after you're trying to research things and really gain a sense of understanding, trying to educate your friends while you're educating yourself and
Yes.
your
Yeah.
partners or your family members, or maybe at times not wanting to do that and still really not really knowing what to do for yourself, and
Yeah.
really having to continue to sometimes wait on other people or other opportunities, especially if you're trying to conceive and you have to wait on whether you can get benefits, or if you can have enough money to freeze your eggs, or to do an IVF cycle or an IUI, or whatever it looks like, whatever money's invested to, if you're willing to adopt, and having to make sure all of those things can align and be sustainable and substantial. There's so many things that can come into this space, but I think even just being in this space can be enough once you're there.
Yeah. And you know what? It takes a lot of surrendering of,
Hmm.
like you said, control. It takes a
Yes.
lot of surrendering to the idea of the picture that we thought we had in our head about how we would conceive and have children.
Yes.
And it takes a lot of surrendering to the process in general, because
Yes.
I felt like for myself, and I don't know if this is how you felt thus far, but when I got my first initial diagnosis, which they told me was a blocked tube in 2012,
Hmm.
I did not surrender, and I did not want to surrender, because so
Hmm.
much of my life I was able to control.
Yes.
My husband and I, we chose each other. You know what I mean? I
Hmm.
chose my career. I chose to
Hmm.
work alongside my husband in his businesses. So I chose all of these different things for my life, and I had control over it as much as I, humanly possible. But then this one thing that I thought I was going to be able to control, because one, I had been on birth control for a period
Hmm.
of time. And then I said, okay, when I'm ready to have kids, when my husband and I are ready to have kids, I'm going to get off the birth control. And when I met him, I had gotten off the birth control. And then we got married 2 years later. And then after 2 years of marriage, 2.5 years of marriage, we decided we were ready to have kids, and we were in a good place financially and stable and everything, right? So I was able to control all of those aspects of my life up until that point of the diagnosis originally being a right tubal blockage, right? And
Hmm.
so when I stopped taking birth control, a couple years before that, I was like, oh, we're good. It's going to happen. When God says it's going to happen, when the Creator says it's going to happen, and then to get the diagnosis like that, all the control that you thought you had in life goes out of the freaking window. And I think that was one of the greatest lessons that I learned, and a lot of people learn when they're going through infertility. Is how do you surrender to the process and just let it be what it is and get through it the best way that you can. You know what I mean? So
Absolutely. Absolutely. My surrender story, like you said, it was one in particular, and I share this a lot, is it wasn't when, I was 19. It wasn't when I lost my ovary. It was actually
mhm,
the year after that. And like you said, so after I lost my ovary, I then was on Lupron,
mhm,
which is a drug that they use for men who have prostate cancer, women who deal with endometriosis, or if they're trying to do some type of hormonal suppression.
right.
And so it is not the best drug, and it put my
Mm-mm.
body through the ringer. And I was on it for 7 months. And while on it, I still wasn't surrendering. I was like, it was literally like my other ovary started
Yeah.
overworking itself. It took time for my body to adjust to not having that other ovary. And so it was just having the one. And I remember specifically just like, okay, do whatever you have to do. At this point, I almost felt like there was such a disconnect from me and my body. And there was still so much anger that it was like, whatever you got to do so that I'm not in pain,
Yeah.
just do it. And I remember specifically, it was May of 2012. And I was actually babysitting for a family, and I wasn't feeling well. And I called one of my best friends, and I was like, I feel like I need to go to the hospital. And she was like,
Mm.
so go. And I was like, but I'm scared because I feel like it's not going to be something that I want it to be. And so, sure enough, I ended up, after babysitting, I had a roommate. I went home, told her I need to go to the hospital. She came with me, but then she had to study for finals. She was still in school. I had finished school at that point. So I was like, you go home. So by 5 o'clock, I'm in the hospital, and I haven't been tended to because it's an emergency room and there are people that actually were in critical condition. So I remember like at 5 o'clock in the morning, dressing myself up, literally putting my clothes back on, going to the receptionist and being like, so I want to discharge myself. And she
Mhm.
was like, sweetie, she looks at my record. She's like, you cannot discharge yourself given your history. And I was like, well, I'm ready to just like go. So she's like, just hang out. So I remember going back into the room, and I remember a doctor coming in, and the question that she asked me was, so how many miscarriages and abortions have you already had? And I remember feeling so frustrated and angry. And I think as a woman of color, I perceive that as her having this like
Bias.
perception.
Yeah.
And I remember again, like ready to hop off the bed and leave. She starts to do the exams. She gets the ultrasound, and I'm in so much pain. And so she's asking me why I'm crying, and I'm literally like, something doesn't feel right. So then around 8 o'clock that morning, a whole team of women come in, and they introduce themselves as an OBGYN team. So I'm like, okay, something really doesn't feel good. And so they explained to me that the quality of that ultrasound machine wasn't the best. So they wanted to take me upstairs to use another one that would be there around like 8 a.m. So we go upstairs, get the ultrasound done. And as I'm waiting, I like am waiting and waiting. And then I see this doctor come with her like surgical, mask. And they're explaining to me that they did not see good blood flow to my other ovary, and that they
Mm.
thought that they were actually going to probably have to remove it. And in that moment, all I could have was this encompassed amount of fear. And I literally was like, I didn't have my phone. I didn't have anything on me because it was downstairs in the room where I was. So I asked them if I could use their phone. And I remember calling my mom, and she was at work. And I was like, you need to listen to me. I'm about to go into surgery. They're going to take my ovary. And I remember as they were like wheeling me down to prep me, I felt lifeless. And I remember actually using social media. And the first thing I thought was, okay, I'm going to post the status and let people know what's happening to me. Because at this point, mentally and emotionally, I don't know how I'm going to like be after this. So I'm going to need people to pray for me. I'm going to need to figure out. So my faith starts kicking in already. And I'm like, all right, God, like you literally have to do this because I have nothing left. And at this point, I'm like 26 years old or 25, maybe going on 26. And I'm like, I can't imagine that I will really never be able to have like kids naturally. And like, why is this happening to me? And I literally felt like I physically was going to fall over in the wheelchair. And then they ended up putting me on a bed. Mm-hmm. And then it was when I saw the anesthesiologist and she was like, all right, she was prepping me. And I literally said, you know what, this is a situation where I literally cannot walk and get up and leave. Like they're literally going to operate on me. And I literally remember closing my eyes and saying, all right, God, it's all of you and none of me. And like, I literally am like submitting to you in a way I never feel like I have ever probably done. And it's this blind faith that I have to have. And I just remember looking at her and then waking up and they told me that I actually still had my ovary, that they just had to scrape some adhesions, that were from the previous surgery that had developed. And I think that for me is a story that I often use about what it felt like to really be faced with what felt like the scariest possibility and that still not be the possibility. And so I think sometimes it's not to minimize anyone's experiences, but when I hear women that are going through it, there's parts of me that it's like, just hold on and just like close your eyes and get on that bed and just like allow yourself to be in the space where it is the scariest thing you have ever felt, but it could not be necessarily the scariest outcome. Or even if it is, like knowing that there's so much more that you can gain from it. And I think that was when that particular experience, when I really understood emotional safety, fear, surrendering, hope, and also how all of those things can happen in one setting. And you can have more than one. You can have more than one feeling at the same time. You can be scared and also hopeful. You can be angry and relieved. There's so many things that can come from an experience and a moment that has such an impact.
That's a powerful story of surrendering to the process and surrendering to what your life is as you know it right now, as far as, fertility is concerned. Wow. And, I think it's very, when you were speaking about counseling with other women and men who are going through fertility issues, infertility, and other types of trauma, and you were talking about being able to connect with people, even though your stories are very different. I sometimes, and I don't know if you feel this way, but I sometimes feel like even though I've been through the process and my situation may not have been as devastating as yours or someone else's, even though I've been through it and I have a lot of love to give to other people, right? Because that's what we do is all about, right?
Yes.
So especially you being a counselor. And it's like you have all this love to give, but sometimes I feel like it's hard to interpret that in a way that's comforting to them. So a lot of times I find myself just listening to people and just reassuring them that although this is what your life is right now, it will get better, but it's also okay for you to feel like this. And we need to deal with this. And I think that's a great point that I kind of heard you say it within your story without actually saying it, is that, just sitting in it. Just sit there. And that was very difficult for me in my go through with infertility, because I am not an emotionally driven person. So I'm very analytical by nature, and I know how to separate my feelings from my situation, right? And so I don't wear my heart on a sleeve, so to speak, in that way. And so that was very difficult for me, and also very empowering after everything was all said and done, because it's allowed me to be able to be vulnerable now with other people about my journey and what I've been through to help encourage and inspire. But what I was going to ask you was, how do you counsel your clients on sitting and just being and trying to be grounded even though they may be depressed?
Yes, I think like what you said, it's like there were literal moments where I personally had to sit, like after I had, because I have had throughout my journey 3 laparoscopies
Okay,
and 1 laparotomy. So
gotcha.
3 incisions through my belly button, through the microscope to either look at or, to remove a cyst. And then when I lost the ovary, the laparotomy, which was the bikini cut incision that they
Mhm.
had to do in my abdomen. And so when the laparotomy, I literally had to sit on bed rest for 2 weeks. Like there was nowhere that I could go. There was nothing that I could do
Mhm.
after that situation where I had that laparoscopy to have the adhesions moved again. I had to rest for a couple days. I had to be still. And so I think that I've also learned how to sit with discomfort in order to support someone else understanding that that is even a possibility. And so I
Yeah.
think part of what I do when I work with people that experience infertility is, one, I just listen, like you said, and I absorb and I connect to what they're saying, the feelings that I'm hearing, or sometimes the feelings that aren't yet said, but you can tell through the experiences maybe present. Having people really just like kind of I reaffirm or sometimes I reflect, and knowing that validation is really important. And I think that sitting with feelings isn't just to connect to them, but sometimes it can be to acknowledge them,
Mhm.
and whether that is to say them out loud or in your head. It can be tending to them, whether that is by listening to a song that you connect to, watching a movie, reading a book, taking a breath. Those are so many ways that you can tend to an emotion, talking to a friend, talking in the therapy session. That is tending to those emotions and that experience. There's other ways that you can sit with your emotions, whether it's just in silence and really not
Yeah.
saying anything or doing anything. You can sit with them through crying. You can sit with them through grounding, whether that's through a meditation, an affirmation, whether that's through, again, having breath work, whether that is through just having something that soothes you. A lot of times I tell people, whether I know for me personally, I used to always have peppermint tea and honey when me and my mom would have to have
Mhm.
conversations, or after every single doctor appointment, we'd go to that PF Chang's and we'd get that junk
Mhm.
Chinese
Mhm.
food, and we'd get a glass of wine, right? And that was still us sitting. We wouldn't talk about the appointment. We would just connect. So sometimes sitting with the emotion can be having a space where someone holds for you. And it doesn't mean that they have to talk about it with you. It could be just that they're acknowledging it, that you need something and joining you in that. There's so many ways that we can sit with ourselves and sit in a space. And I think that's what I try to offer and highlight in my sessions.
Yeah, that's awesome. You made a lot of great points, which I'll add to the show notes so that people can really delve and sit with the ideas that you've given for sitting in your feelings and just being. And I found that not so much through prayer, because
Mm-hmm.
prayer is more so about making a request known and giving thanks to the Creator. But I
Yeah.
found with meditation,
Mm-hmm.
it it teaches you how to sit and just be and
Yes.
just find that level of groundedness. And it's very important, I think, with any traumatic situation, no matter whether it's stillbirth, miscarriage, losing an ovary, having a tube removed or anything such like that, or hysterectomy. um, there's just so much that happens when you get the diagnosis of, okay, we gotta redo this thing, we gotta remove this thing, or we gotta fix this thing. And I think a lot of people struggle, and I know I did, with getting the diagnosis, and then, like you said, having to deal with all the appointments and the medication that comes with along with that, and
Yes.
in navigating. So like you're grieving the fact that you have to even go through this. Then you got to deal with all these freaking doctors of visits and appointments. And for us who go through IVF treatment and IUI and such, we it's a you know it's a willing service, because we offer our body to do that, to have children. But at the same time, it's still very overwhelming to have to
Absolutely.
get because you go into the doctor's office just thinking, oh, maybe we just need an IUI, one of the simplest forms of, infertility treatment, or fertility treatment, right? But then you get this whole other medical condition that comes along with it. So I have been telling people who come to me, and then I have also been advocating for, when you get your diagnosis, maybe, just maybe, you need to wait before jumping into treatment,
Yes.
and just letting that process. So how do you help your clients with their diagnoses and their different traumatic situations that they deal with, and how do you reassure them, and how do you help them cope with family members and friends and acquaintances who will ask them a bunch of questions and bombard them with, you know, all kinds of questions, and and everything, out of love, of course, but just a lot of that can be overwhelming as well. It's getting bombarded with questions and all these things too.
Absolutely. There are times where sometimes I think, again, like emotional safety is so important to me personally and professionally. And so there are times where I think also feeling that support, because I think also, like, as you're saying, too, acknowledging that infertility can feel so isolating. And it may be something that, as we're building this community, even me and you being able to speak and share our experiences, I definitely resonate and feel very connected. And this podcast and your mission and your purpose, and then also being able to express part of mine here, right? And I think that a lot of times when someone is initially going to see me, they're looking for some type of support because they
Mm-hmm.
don't have that yet. Or they may not know fully how to, share it, whether all of the spaces that they really want to share with a partner or their friends or their family, or what they are feeling after the doctor's appointments. And so I think that having that space where I try to really get them to first understand what supports do they need, kind of
Mm-hmm.
slowly getting into the feelings, and then also looking at the readiness for them to be present. Really noticing if there are times, sometimes I have their partners or people that they want to come into a session, so that I can also be a space that navigates some things that they're really thinking about. Sometimes it's journaling and having them write the things that they want to say to other people
Mm-hmm.
before they can actually express it. Whether it's suggesting books and having bibliotherapy, where there's books that can either really relate to fertility and different aspects of fertility, or sometimes just the theme emotions that come out of it. Really also thinking about, again, sometimes I will make playlists with clients of songs that they can use before an
Yes.
IVF appointment, or the songs that they need to listen to when it's not successful, or songs that are just all about anger that they need to get out. Having spaces where we think about the things that they can use for coping. Something that I'm working on professionally, and also something that I do, is have a coping toolbox, where
Mm-hmm.
I worked with kids when I worked at the domestic violence shelter. And it was really helpful for the kids, especially from 6 to 18, to have a little like shoebox that they could use that had ways for them to cope, so that as they were transitioning into the shelter and they had so many losses that they were going through, this little box created a sense of safety and had tools in there. So sometimes I will do just like more metaphorical, like coping tools. And then
Mm-hmm.
sometimes I will literally have hands-on things. And so for me, in my toolbox, I have journals. I have affirmation cards. I have essential oil of lavender because it suits me. I have, again, like list of songs for playlists that I want to listen to, so that I can just tap on them to my phone. I have,
Right.
again, things that I may like, if there's books, if the box is big enough, whatever you want to put in that space to help you move through it. Tea bags, all of those things I think can be helpful to help people when they're navigating the things that they are dealing with and going through. I usually will have people, process their doctor's appointments, and we talk
Mm-hmm.
about the impact that that had, or if they have questions, making sure that they're able to write them down, and also feeling like that sometimes I think we can feel like the doctors are always the expert, but we also can be experts of our own bodies to a degree. And
Absolutely.
so I also want to like advocate for people to not just go into an appointment and then walk out of it with this heaviness and uncertainty and not ask for clarity. So I think part of what's really important for me in the process is understanding your feelings, connecting to your voice, sitting with your emotions, figuring out what you need and the coping that comes with that, building your community and your support systems and what that looks like for an individual and how they navigate that.
Awesome tips. Awesome tips. And then also what I'm hearing from you is using tools that you would normally use when you're not necessarily going through something traumatic. So for say, you know, uh, I think a lot of people sometimes forget, that, okay, I love music. So I'm going to
Mm-hmm.
use that as a way to soothe my spirit, right? And like you
Yes.
said, journaling. A lot of people do that naturally, but then when they go through something traumatic, because it's like this hustle and bustle, and I always have this image in my head of like a bunch of cartoon characters running around crazy, because that's how you
Yes.
feel after you've been through something or you're in the middle of it, and then we forget about, oh, I love music. Oh, I love to sing. Oh, I like to write
Mm-hmm.
poetry. Oh, I like to journal,
Exactly.
take long walks, like just getting back to the basics of soothing ourselves mentally, spiritually, physically, emotionally. A
Yes.
lot of people like to pray. A lot of people like to meditate. A lot of people like acupuncture. And I think that's
Yeah.
important. And that's a great point that you make about just, doing the things that you love and then doing more of that in the middle of your go through. That's awesome
Exactly.
tips. Awesome tips. Well,
And
Kendall,
also giving
yeah,
yourself compassion, because I think
yeah,
that that's so hard to do. And I think that the more compassion you give to yourself and the more compassion you give to the process, and knowing, okay, there's days I may not want to create, something. There's days where I just am angry. Okay. And so you don't have to change it. Just give yourself compassion towards it. Right. And so I think compassion is also something that I also help people gain an understanding of for themselves individually, what compassion looks like for me in this journey. And what is that going to, how do I use that as a tool to get through this and to move through it? Even if it's not getting through, it's moving through,
mm-hmm.
and what that looks like.
Yeah, that's a great point. I've been saying a lot. I think I made a post about it recently about being
Mm-hmm.
gentle with yourself, and
Yeah.
and that was a really big lesson for me too, because I'm so self-critical, and so when I go through something, I'm like beating myself up. Well, how can I fix it, or what could I have done differently, and things like that. But going through infertility really taught me to just have more compassion for myself. And see, I feel like for me, it's so easy for me to have compassion and empathy for others and have love for others. It comes naturally to me, but I am so much more hard on myself.
Mm-hmm.
And I think that a lot of people will resonate with what you just said about having compassion for self before
Yeah.
anybody else, especially if you're in a relationship going through the journeys. Um,
Yes.
and then there's some people who are doing it single, so it's really even more difficult for them. So
Exactly.
yeah,
And
that's a great tip. Yeah.
And also, it's like the compassion for your body, because I think sometimes we can start to have this sense of panic when our expectations of ourselves shift, and then we have this expectation of what we want our body to still do. And I think for me, it wasn't until I really went into the egg freezing
Mm-hmm.
space, and I had a very low ovarian reserve in my egg count. And I remember right before it was time, I think, to do the first cycle, because I did 3 attempts. I got 2 eggs from one, none from the second, and then
Wow.
7 from the third, but only 4 were mature. So 6
Okay.
eggs in total out of 3 attempts. And I remember when I knew that I was only going to get maybe 3 out of the first, and I was so sad and disappointed. And every, appointment was just this nerve wracking, like, will or won't, what will
Mm-hmm.
happen, and knowing that I had to wait until after it was done to figure out if those were even viable. I remember having this moment where I said to my body, like, I'm not mad at you. And I want to listen to you. And
Yeah.
I want to love you, not want to just love what I'm expecting of you. And this
Mm-hmm.
is hard for me. And I can tell it's hard for you too. And I want us to be connected, because I don't want it to be something where I'm trying to make you do what you can't do. And as much as it is hard for me to even figure out what accepting you looks like, I want to be as open, and I need to be patient with me while I'm being patient with you. And so it's like having that compassion too, not just to your thoughts and to your vision, but to your body that you're actually really using while you're going through this.
That is excellent. Excellent point. Excellent point. I've never heard anybody describe it like that. And yeah, I don't have anything to add to that, because that's an amazing, amazing point. It's just that's part of what we were saying before, is being still and not just connecting emotionally, spiritually to ourselves, but the physical connection that we make with our bodies and speaking to our subconscious minds
Mm-hmm.
about our situation is so important. And I don't say that in a sense that you are trying to, talk yourself into healing your body. A lot of people
Exactly.
practice that, but when there's a
Yes.
medical condition, it's a lot more,
Exactly.
complexities to the situation. So it doesn't quite work the same.
Exactly.
You know what I mean?
Exactly.
So I don't want to, I'm not saying it in the sense of that, but the sense of just saying to your body, look, like, for instance, I have an affirmation in my journal that I go back to, and I have it marked so I can go back to whenever I'm feeling low. And one
Yeah.
of the statements is, I am enough,
Yep.
or, my body does what it needs to do, and my body takes care of me, things like that.
Exactly. Exactly.
Loving affirmations for your
Yes,
body.
and those are
Yeah.
acknowledgement, right?
Yeah.
Exactly. And so like you said, it's not to try to like heal ourselves, but it's actually a part of healing is acknowledging.
Yeah.
It's acknowledgement. And so it's acknowledging your body and the state that it's in. And as hard as that can
Ooh.
be such a catalyst to the
Mm, mm, mm,
process.
mm. So difficult to say to your body that's not doing what you want it to do.
Mm-hmm.
And at the time that you wanted to do it, to say, look, I love you. You're enough. We're in this together.
Exactly.
And yeah, that is powerful stuff right there. That's a whole other podcast episode.
And we
I'm
could
telling
definitely
you.
do
Yes,
it.
yes. It's just getting to the basics of connecting with our feminine energy for us women, and then for a
Yes.
man to be able to connect with his masculine and feminine energies. And I think a lot of men struggle with that too. I have some male listeners, and it's hard for men to sit still and just be,
Mm-hmm.
because they feel like, oh, I'm the man, I got to be doing something, I got to be doing busy, this and boss that, you know what I mean? So
Yes.
women find it quite easier to do that, but for men, I know it's difficult. And for some women like ourselves, it's difficult too, to just tell your body, look, it's me and you now, daggone it, so we got to figure out a way
Yeah.
to be able to come into oneness with each other. And a lot of people
Exactly.
in the spiritual community, and in Christian communities and other type of religious communities, say that we have to be at one, and we always talking about being one with each other and with the
Yep.
creator, but nobody ever talks about being at oneness with yourself in your own
Yes.
freaking body, your own temple.
Yep, exactly. And so I think
Exactly.
that that's also something that I add professionally and also something I still try to incorporate, like, personally. It's, I think sometimes people look at it as, okay, what medicines are we taking? And we look at the food we're eating as, how we're helping our body help us. But it's,
Hmm.
no, are we listening to it? Are we
Yeah.
actually acknowledging it? Are we actually giving it the compassion it needs while it is trying its best to meet ours? And what do we do when we are disappointed with it? Right. And I think those
Yeah.
things are just as valuable.
Yeah. This has been such an awesome discussion today, Kendall. I thank you for your time, because we've been on
Thank you.
the phone actually for over an hour, but
Yes.
but oh my God, this is wonderful, wonderful. And everybody, I'm going to leave Kendall's social media and her website, so that you guys can connect and heal with her in a more personal way. And you guys will love her Instagram. It's very organized, and it's very intentional on what she wants to do to help other people. And I thank you guys for listening, Kendall. Um, Girl, yeah, this is it. Thank you again, dear.
And you are too. Thank you so much. Like, seriously, it's been such a blessing.
Thank you so much.